Hello and welcome to Let's Medicine. So today's topic is the causes of abdominal pain by location. So basically the abdomen is divided into right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant at the mid epigastrium. So if there is a pain in the right upper quadrant, we are going to suspect cholecystitis. What is cholecystitis? It's the redness or the inflammation of the gallbladder. Second one is the biliary colic. It's the pain in the abdomen due to the obstruction, usually by the stone in the cystic duct or common bile duct of the biliary tree. Then it's cholangitis. Cholangitis is the inflammation of the bile duct system. And the fourth one is the perforated duodenal ulcer. It's the perforation in the duodenum due to the ulcer. Okay, now if the patient is having pain in the left upper quadrant, so we are going to suspect splenic rupture or splenic flexure syndrome. By the way, what is splenic flexure? Splenic flexure is when the transverse colon starts descending downward. So that place is the splenic flexure, and the splenic flexure syndrome is when the splenic flexure gets distended and the symptoms like bloating, fullness, and abdominal pain starts to occur. Right lower quadrant pain. A right lower quadrant pain may be due to appendicitis. Appendicitis is the redness and inflammation of the appendix. Then it's the ovarian torsion. It occurs when the ovary or sometimes the fallopian tube twists on the tissues that supports them. Then it's ectopic pregnancy. Ectopic pregnancy is when a fertilized egg grows outside of the uterus. And then it's cecal diverticulitis. Cecal diverticulitis, it's the abdominal pain that's nature is clinically very much similar to that of the acute appendicitis, but the cause is basically not known. The pain in the left lower quadrant may be due to sigmoid volvulus. Sigmoid volvulus occurs when a portion of the intestine twists around its own blood supply. Then it's sigmoid diverticulitis, a condition that occurs when a small pouches or sacs forms and put outwards to the weak spots of the wall of your colon. Then it's ovarian torsion, same that was explained in the right lower quadrant, and ectopic pregnancy in fallopian tubes, etc. Okay, if there is a pain in the mid epigastrium, so we will be suspecting pancreatitis. It's the inflammation of the pancreas. Aortic dissection. Aortic dissection is a serious condition in which a tear occurs in the inner wall of the body's main artery, that is aorta. Then it's the peptic ulcer disease. It's characterized by discontinuation in the inner lining of the gastrointestinal tract because of gastric acid secretion or pepsin. So that was pretty much it about the causes of abdominal pain by location, the quadrant wise. Thank you for watching. Meet you in another video.